I'm Anderson Reed. I'm a professional tennis player from Fort Lauderdale, Florida. The main problem in my back was I had little strains and tears of all the little fibers around my vertebrae, and they weren't strong enough to hold any of the rehab that I was doing.
So looking at Anderson's injury, the original injury that was read on the MRI was an L4, L5 disc tear. Now, when we began to look at his problem and saw that he had a lot of right-sided spasticity, which seemed to be affecting his psoas, we had to look deeper. And this is very important when you see a doctor who practices regenerative medicine. You want to go to someone who looks at a comprehensive approach. His T12L1 disc had collapsed. Couldn't remember the injury, but clearly there had been an injury here, as the disc was about 20% of his normal height. When we shot x-rays, we saw there was bone growth, osteophytes, fragments of bone growing into the psoas on the right side.
I heard about OCYON through online research. I found a YouTube video of Dr. Bashir giving a conference in the Dominican Republic, and I really liked his work. I watched the whole thing. It was an hour long, and he seemed very knowledgeable and very accessible. So I gave him a call. I've heard previously that surgery can limit your range of motion and it can relieve pain, but that's not really what I'm looking for in my line of work. I want full range of motion and I want to heal naturally. So through PRP injections and Dr. Bashir's knowledge, we were able to strengthen those, and my back was able to heal and go through the rehab necessary to get me back on the court.
So the complete treatment in his case was treating the L4, L5 disc tear, as well as the nerve roots around the collapsed disc, and then entering and injecting platelets and healing molecules as well into the psoas muscle to regenerate the muscle. And using that complete approach, we were able to calm down the muscles, heal the disc, and heal the nerves.
So the procedure itself was very easy. Dr. Bashir put the right nerve blockage in there, so there was relatively no pain at all or discomfort. So the procedure is definitely less invasive than surgery, and you walk out the same day. The road to recovery is fairly easy. Life after the treatment is a lot easier. My mornings are normal. I get out of bed with no pain. Warming up for my tennis practices and tournaments is way easy. The tennis circuit for me this year is going very well. I've been healthy for about 7 or 8 months now, and there's been no sign of a relapse of my injury, so I'm really happy about that. The team of Randy and Dr. Bashir is very good. They complement each other well. I still work with Randy on a day-to-day basis. He's very good at functional recovery.
Working with our myofascial specialist, who then went in and relieved tension throughout his body, has enabled him to continue to heal and move back onto the professional tennis circuit.
The best part about these procedures is using your own body's natural ability to heal. And if anyone is on the fence about that, I think that you can give Dr. Bashir a call and he'd be happy to help you. And I'm glad that I opened that door, because at the beginning I didn't think that I would be able to move around like this. And now I'm happy that I did. I'm very happy that I know and have a relationship with Dr. Bashir now. He's very professional and knowledgeable and really cares about his patients.